Hi guys, it's Tom from Fitcure, and today we're going to talk about the assessment process and exactly how that relates to program design. So what we're looking to do when we're designing a program is we're looking to restore function. So function is a word that's sort of branded around a lot, but what does that actually mean? Well, function to me is being able to perform everyday tasks without due exertion. So if we break down the movement patterns that we make in everyday tasks, let's go through. So everybody, it's unavoidable in life. We do squatting. So we sit down and we stand up. It's unavoidable. Yeah? We pick things up from the floor. We do like what we call a deadlift pattern, where we pick something up and we extend those hips through. We do some sort of single leg knee dominant movements, so whether or not we're tying our shoelaces, doing some sort of lunge, we're stepping up and down on blocks. We reach on one leg, we do a single leg hip hinging movement pattern. We push and we pull in a horizontal, pushing and pulling opening doors, and we push and pull in a vertical pattern. So we pull down that washing and we reach up high into cupboards. So these are the movement patterns that we make. These movements are unavoidable in life. So when we're looking at designing a program, these are the movements that we want to put in. However, if I just went in the gym and just started loading you guys up with a load of weights, boshing these movement patterns out, short rest intervals, lots of reps, I'm probably going to potentially cause some injury, exacerbate those pre-existing postural flaws. So here comes the dilemma. So what do we do? Because these are the movements that we perform in everyday life. Well, we use what's called developmental neuromuscular sequencing, DNS. I love that word because it makes me sound really intelligent. So what DNS is how the baby learns to move. So baby starts off life from the floor, and then from the floor gets to all fours, and then from all fours gets to kneeling or half kneeling, and then baby gets up to standing, and then at about a year old it gets into running, jumping, and all the kind of crazy movement patterns that babies like to make, yeah? So we can break movement down into levels. Level 1, level 2, level 3, level 4, and level 5, yeah? So how this relates to the functional movements that we spoke about before. So let's use an example. So if we use the deadlift, for example, so picking something up from the floor, yeah? So the deadlift is a hip extension movement pattern. So it requires extending the hips forward. So that movement pattern might start out as a simple glute bridge, where somebody's laying on the back and then they just bridge those hips up into the air, yeah? And at level 2, maybe it's a feet elevated glute bridge. See how it gets a little bit more sort of all foursy and there's less contact with the floor? Or maybe it's a head elevated glute bridge. Yeah? And at level 3, it might be somebody kneeling with a band around the hips if they've got good knees, and then extend those hips forward from that position there, yeah? And maybe at level 4, it's somebody picking up a kettlebell from some blocks maybe. And again, as I said before, there's lots of progressions within the progression. This is maybe an oversimplification, but it's just to sort of give you a general idea of how program design works. And then at level 5, you're an absolute ninja at this point. You've been training for a good 9 months, you're in tip-top shape. You're going to be doing maybe a long jump. Or maybe if you want to be an Olympic weightlifter, you're throwing that barbell over the head and doing a snatch. But how the long jumper got to the long jump and the Olympic weightlifter got to the snatch was over a period of time. They sacrificed that stability, those points of contact with the floor, and that what we'd call kinesthetic feedback, that feel position, so they can feel the position. And eventually got up to speed and athleticism and those sport-specific movement patterns, yeah? So with regard to our assessment process, we would assess you through these movement patterns in a stealthy, non-provocative way to make sure that we're not exacerbating any of those postural flaws or causing any injury. And then we can pitch at which level each one of those movement patterns is going to be. So you might have a phenomenal squat. So maybe that starts off as a squat to a box. Or maybe the squat's not so good and it's a little bit painful. That might maybe start off as a static wall squat, just to give you an idea. But the idea being the exercise selection, the sets and reps are the key, which is going to get you exactly where you want to be and build that strong foundation of strength. So all we keep doing is progressing as opposed to getting to a point where we maybe overload you and get injured. So that's the assessment process.